My name is Catrice Thomas. I'm a registered nurse, and today I'm here representing the millions of Americans living with, or should I say suffering from, pain caused by cancer, cancer treatments, AIDS, multiple sclerosis, debilitating peripheral neuropathies, and muscle spasms, just to name a few. Today, the argument is not whether or not there are proven benefits to the uses of medical marijuana, because that has been proven time and time again. But the issue at hand is whether or not the present classification of cannabis and its organic compound is appropriate. Today, marijuana appears as a Schedule I drug amongst controlled substances. My stance is that marijuana should not be classified as a Schedule I drug. And in order for research to continue, you, the members of Congress, should consider reclassifying marijuana into a category that is more appropriate. Before we start to talk about classifications and the different schedules, let's first talk a little bit about history. Marijuana has a long-standing history throughout the United States. According to records, the first medical uses of marijuana dates back approximately 2,000 years. And for most of American history, growing and using marijuana was legal at both the state and federal levels. By the 1840s, marijuana's therapeutic potential began to be recognized by U.S. physicians. And in 1854, the medical use of cannabis received official legitimacy by its listing in the U.S. dispensatory. However, by the end of 1936, all 48 states had enacted laws to regulate marijuana. Its decline in the medical world was partly due to the creation of things like aspirin, morphine, and opium-derived drugs. Then in 1972, the U.S. Congress placed marijuana in Schedule I of the Controlled Substances Act, because they considered it to have no accepted medical use. Times have changed, and research has proven that there are, in fact, medical benefits to its use. Since then, 18 of the 50 U.S. states and D.C. have legalized the medical use of marijuana, not to mention the 2 states that just recently legalized marijuana for recreational uses. But that in itself is not the issue at hand, and that's not the argument. The argument is the schedules. And I want to kind of put this into perspective, and to do that, let's do a little comparison. By definition, Schedule I controlled substances must meet the following 3 criteria. Again, all 3 criteria must be met in order for it to qualify as a Schedule I drug. 1, the drug has a high potential for abuse. 2, the drug has no current accepted medical use and treatment in the United States. And 3, there is a lack of accepted safety for use of the drug under medical supervision. Now, some examples of Schedule I drugs include heroin, LSD, peyote, and ecstasy. Now, when I think of marijuana, I don't think of it along the same lines as heroin and LSD. And again, that's just my personal opinion, but based on the description, it doesn't line up as well. Now, let's talk about Schedule III drugs. By definition, the Schedule III drugs, 1, have a potential for abuse that is less than the drugs or other substances listed in the Schedule I and 2. 2, the drug has a currently accepted medical use and treatment in the United States. And 3, abuse of the drug may lead to moderate or low physical dependence and or high psychological dependence. Now, some of the drugs in Schedule III include Vicodin and Suboxone, both of which are opioids. Not to mention, we have a huge epidemic on our hands with regards to prescription drug use. But that, again, is also another issue. The focus here is whether or not the current classification of marijuana is appropriate. Based on evidence currently available, a Schedule I classification is just not justifiable in this case. It's not accurate that cannabis has no medical value, or that information on safety is lacking. Another issue with marijuana being considered a Schedule I drug is that prescriptions cannot be written for these Schedule I substances. And denying cannabis treatment to the sick and dying is unnecessary. Reclassifying marijuana will allow practitioners to write prescriptions for those in need, and more importantly, those in need will not have to fear prosecution by the federal government. It's true that marijuana does have some abuse potential, and it's true that marijuana is just not for everyone. But the fact of the matter is that its profile more closely resembles Schedule III drugs. Now, history has shown smoking marijuana as somewhat of a rite of passage, and that may be putting it loosely. No response is needed here, but has anyone in this room ever tried marijuana? What about heroin? Now ask yourself, why did you decide to steer clear of one over the other? That's my point, because they're not the same, and they should not be categorized and classified as such. At the government's request, the Institute of Medicine performed an 18-month study evaluating the therapeutic effects of cannabis, and the results showed that cannabis is not highly addictive, nor is it a gateway drug. But in fact, the results show that cannabis does have therapeutic value for patients with cancer and AIDS. But again, that's no surprise, because there's tons and tons of studies that support this very same thing. Terminally ill patients do not pose a threat to the public, nor do they encourage illegal trafficking of drugs. When used properly, like with opioids of the world, marijuana is a very valuable medicine. Since 1970, approximately 160 substances have been added, removed, or transferred from one schedule to another. I want you to make marijuana one of those drugs. Reclassify marijuana so that medical research can continue. I stand before you as a healthcare provider that cares deeply for her patients. I stand before you as a provider of care that does not want to see millions of Americans suffering in pain. And I advocate for each and every one of them. Changing the classification of marijuana will help facilitate better, more inclusive research. It will allow practitioners to write prescriptions for those in need. Continuing the federal prosecution of medical marijuana patients and their providers in accordance with marijuana's current status as a Schedule I drug is unjust punishment. Remove marijuana from the list of Schedule I drugs. Allow for more research into the endocannabinoid system, and help those out there that are suffering from debilitating pain. Thank you for your time, and I hope you strongly consider the position that was presented to you.